everyone. My name is Dr. Kavitha Krishnan. I am the founder and pediatric occupational therapist at Healing Synergy, which is a pediatric therapy clinic based in North Carolina. Healing Synergy specializes in occupational, physical, and feeding therapy for children with sensory issues, special needs, and feeding difficulties. What we do is we customize home programs to meet your child's needs, strengths, and the treatment goals. Should you have any issues or if you would like to inquire, please reach us through our contact page at healingsynergyllc.com. We look forward to hearing from you. Thank you. Dr. Stancliff, so if you could describe a little bit more about the least restrictive environment and what you mean.
All right. So I have this really cool visual for least restrictive environment that can kind of help parents understand. So regular education is, of course, where the person is essentially not restricted at all. They're with their peers 24/7. And that's right up here at the top is that least restrictive environment. And then remember, we've talked a little bit about response to intervention. That's right here. PBS is another type. That 504 is here because remember, 504, they're going to have accommodations, but they're not going to have that specialized instruction. So they're going to be with their peers 24/7. So after we leave this side of this sheet, then we begin to move towards restricting that child. And what it means is we're restricting them from their regular peers. So as we move to say, let's change colors. Let's see. As we move to a resource setting where they're getting their special education and they're getting it in that separate EC classroom, that's pulling them away. So that's a little more restrictive. And then that separate school is right here. So this means that they're in a school where they don't even have their peers. And home is the most restrictive environment that a child can have in an educational environment because they're not with their peers at all. And they're not with their disabled peers or their regular education peers. They're with their family, which is great, but school-based, it's all about all those school pieces, which are also that social and emotional pieces and participation and those skills that are built within a classroom. So that's what least restrictive environment really talks about is where am I being served and am I with my regular typical peers? And do I have access to that relationship with my peers?
Wow, that was very clear. And I also like how you moved along to show us what it meant. Even the home is so different from early intervention, where early intervention you want it in the natural environment, that's the home. But for educational purposes, for a child, that's that is the most restrictive because they're with peers.
Right. And we have children who medically need to be seen at home because maybe they're too fragile to come to school.
Right.
But that really shouldn't be too many of the children that we serve.
Okay. Can I move this into the direction of OT's role with, the increase in the numbers of autism that we see right now? What is the OT's role in that right now?
All right, so I'm going to share my screen to kind of do one more thing, and I'm going to kind of circle back around to your question. So stay with me. Let's. So when we're looking at school-based occupational therapy, the other thing you need to think about, remember least restrictive environment, then we also need to think about how can that OT practitioner support before we get all the way up here to the IEP, because we know that this is the most restrictive. So they've expanded the role of the occupational therapist and occupational therapy services related service in that we used to only be able to serve children who were already here. That was the only place we could serve students. But with response to intervention, remember I told you it was a pyramid.
Right.
So here, back in that level 1, when I mentioned kind of that handwriting intervention, This is where the OT practitioner can consult with teacher and parent and come up with some strategies and interventions before we have to move all the way up here.
Nice.
So we can consult with the teacher and parent. We can even be part of that next level and be the expert on if it's one of our skills, like if it's handwriting, or if it's ability to kind of work within the routines of the classroom. We might be the expert, and we might be able to then collaborate with that teacher and IEP team, or collaborate with the teacher and other people in the building to make this child successful before we have to, again, jump to the most restrictive environment. And we can be part of that problem-solving team in this last tier before we get to that IEP. So this kind of helps us understand that as OT practitioners, and helps parents understand that we can play different roles. Ultimately, our most known role is that in the IEP world and part of the IEP team, but we also can be collaborative before that.
This is great. I'm looking at tier 3, where you talk about skills focused small group instructions, after school programming, and also parent training.
Yes. And some of these are, to me, roles that we haven't, so parents beware that these are roles occupational therapy practitioners can do, but we're evolving, right? We're trying to figure out how to be the relative service that's more inclusive, and administrators determine our ability to have some of these non-traditional roles.
Right. But it's definitely out here. So that's something that they might actually see with their own therapist. So that is pretty neat.
Yep. So now you specifically asked me about autism, and I'm going to share my screen again. I have pulled up the latest from NC, North Carolina DPI. So that way we're kind of talking from their paperwork. So if you're thinking that your child has autism, then of course we're going to make that referral, and you will have to sit in a meeting and essentially consent for an assessment. And what assessments are needed for autism? So if you look here, required screening and evaluations for autism right here. So you always have to have hearing and vision with any disability category with North Carolina Department of Public Instruction, and probably within any Department of Public Instruction across the country, because the first thing we have to do is make sure that it's not a hearing problem and it's not a seeing problem, because that would negate other problems, right? If you have one of these problems, that would be kind of like the top of the pyramid that we would have to get addressed before we could go below. Then this motor screen is very important, but the one that's been added over the last 2 years is this sensory processing evaluation. So your occupational therapists are traditionally now doing these assessments. This started in 2019 was when they were rolling it out, and 2020 was the mandate, and of course COVID hit. So a lot of the implementations have been a little bit delayed, but this is a 2021 document that I have pulled up. So that sensory processing evaluation should be done by the occupational therapist. Now, this might be a sensory processing measure assessment, a sensory profile, or it could be some observations across settings in your child's school environment. A lot of times I like to look at first thing in the morning, group time, then some play, so centers time, and then moving into the cafeteria, kind of little glimpses along the day to see what the child is doing and what might be interfering with your child's performance and access to that educational environment. After we do all of these assessments here, and then you're going to come back as an IEP team, and they have to be able to answer some of the following questions. So right here, make this a little bigger. We have to remember that autism requires an impairment in communication, impairment in social interaction, an unusual response to sensory experiences, some restrictive, repetitive, or stereotypic movements. And then how are those impacting that educational environment? And we kind of talked about that earlier, in that my daughter had sensory preferences, but it never impacted her educational environment. But we have to have those. So if you have a child who's high functioning with autism and it's not impacting their educational environment, then they wouldn't meet the criteria for this particular restrictive special education. They might, yeah, they might need modifications like in a 504, but they wouldn't need a full IEP. It's individual.
Mm-hmm. See that.
And that's this last question. What evidence is there that your child needs specially designed instruction? Because remember, special ed is specially designed instruction.
Right. That's very clearly laid out to show the distinction.
Yes.
What they exactly need.
Yeah. So if they need a different routine, a modification, maybe they need 5 minutes warning before the next task because transitions are hard, but that's all they need, that would be a 504. That's not, he doesn't need special instruction in math or reading or writing. He just needs that little accommodation, that little modification, which is like, hey, whatever the child's name is, you have 5 minutes, then we're going to transition to. And those are quickly things that can be done in an environment that don't require this kind of restrictive services.
Okay. Have you encountered where maybe the parents have a different thought process or idea compared to what maybe the IEP team is thinking of for the child?
So yes, and it can be either good or bad. It can be that the parents want more restrictions than the child needs, and it can be that they want less restrictions and the child needs those restrictions. In my experience, kind of ability to follow directions, follow routines, and participate in the classroom environment are key to a child being able to be with his peers. Because the teacher has 30 children in a regular ed classroom, and each one of those children have to have certain cognitive skills and executive function to be able to regulate their body and regulate their ability to follow those directions to allow the classroom to function. Now, the parent is allowed to go to the state level and ask for state liaison. And if they feel like the IEP is not what they wanted, probably one of my standout IEP meetings was done by a state representative. She walked in, she wrote the child's name down, she put the child's name in the middle of the table and said, every conversation is about this child. And it really helped keep the IEP team, including parents, focused on the child. And that's what it is. It should be focused on the child.
Well, thank you for that, because I know sometimes there might be a disparity, but really it's pulling in and really what's best for the child itself.
Yep. And none of the decisions made by it, the IEP lasts for a year, but it doesn't have to last for a year. So any member of the IEP team can ask for a meeting. Okay. So if parents, if you know, I've seen children change based on development or based on a medication, based on, you know, things where like what the IEP decided was too much. The child didn't need it. Or based on getting it started, they need more. So it can go either way, but the IEP is reviewed at the very least yearly, but it can be reviewed more frequently by the parents and or the teacher.
That's awesome. And the child, after they're 14 years of age,
Yes,
correctly, can contribute to the IEP
yes,
as well.
they can.
Awesome. I would like to also talk about mental health, which is new. You know, what OT's role and contribution is to mental health.
So it kind of with that 2019 rollout, that was another area that was expanded for related services, specifically occupational therapists and occupational therapy practitioners, but we can serve those children. Again, that is a category. The category is emotional, and there's criteria, just like with autism, there's criteria for that category. You know what? Let's stop for a minute. Let me see if I can find that, because this worked out really well. I like that. All right, so we're going to talk about that emotional disability. You can see here the worksheet. Again, this is our North Carolina worksheet. And we start with hearing and vision, and then we're going to look at interventions, because remember, we want to make sure that the child didn't respond to those lower interventions before we get restrictive with an IEP. And we get information from the team. What I really want to look at is page 3, because this talks about our criteria for getting services based on the student having an emotional disability. So they have to have at least one of these have to be checked at that meeting. The inability to make educational progress cannot be explained by an intellectual, sensory, or health factors. The inability to build or maintain satisfactory interpersonal relationships with peers or teachers, and it's been going on over a long period of time, or has a marked degree, so it's definitely interfering. Maybe they have abnormal feelings for a long period of time, I think, and then that persuasive mood disorder, unhappiness or depression. And then finally, the last one is the tendency to develop physical symptoms or fears associated with school. Again, all these are over an extended period of time. Now, with that, occupational therapy, if the child has this disability, occupational therapy can be part of that related service team once they meet this criteria. So we know that with COVID, mental health across settings has been impacted. I recently read an article on the mental health of mothers that had children during 2020 and how that was impacted because of the isolation they felt as new mothers. But we also have seen that being in their home and teenagers and children not being able to socialize with peers and family has been detrimental to mental health, from depression to anxiety. Now that I'm out in the public and people are too close to me and in my space and I'm around way too many people. I kind of felt that way the first time I got on an airplane back in the spring of 2022. I was like, hey, I've been in this tube too long, and this person sitting next to me is definitely closer than I'm used to, right?
Right.
So our students are experiencing these same things. And occupational therapy practitioners are mental health providers, first of all, in North Carolina. That is a state-by-state designation, but we are mental health providers. So we can work with the teachers. Remember that collaborative piece. We can work with teachers and the student to find ways to either deal with the emotional pieces, modify environments. One of the things, that attention deficit children often have some mood disorders. They also notoriously struggle with turning in homework. It's like the number one thing. They hold themselves together all day at school and they get home and they're done.
Yeah. Mm-hmm.
So, working with the student and the teachers on how to get that homework done and turned in. So one of the modifications I used was Google Docs. So they would do their homework on a Google Doc and immediately share it with their teacher. So they no longer had to worry about bringing that piece of paper back because it disappeared into book bag land, never to be seen again.
Right. They're done with school. It just takes so much for them to just focus. Yep, you're right.
It does. And so Google Docs is my friend. Now through Google Classroom and through other platforms like Remind, even scanning with their phone, turning it in as soon as it's done so they don't have to remember it the next day. Like those are modifications that the occupational therapy practitioner can work with student and teacher to make that student successful. Taking pictures of homework assignments, because that's the other one, is when I get home, I don't remember what my homework was. Yes, I have this beautiful calendar that they gave me in middle school, but I don't ever write in it.
Right.
And so it's the one time, take out your, we can get permission, take out your phone, take a picture. When you get home, you can't remember your homework, you at least have a picture of it, because most teachers put homework on the board.
Right. That's a quick way for parents to access it too. Like,
yes.
What's the homework for today?
Right. And then strategies for anxiety and, deep breathing, yoga, not during the day, but yoga before school or after school, or a big walk before getting up early and making sure I have my walk before I go to school, because physical exercise is linked to mental well-being. So if we can build that in either before or after school to allow for the resilience to make it through the day. Those are things. And it's real important to understand that occupational therapy in the school system, we have to make our interventions work within the school routine. And we don't want to be restrictive. We don't want to be pulling you out for a yoga class in the middle of your history class because you need history and you have to graduate. So we're going to work within those routines, like when can you do it that it fits.
Okay. That's actually good to know. So it's kind of weaved in so that it doesn't interfere with the subject matter that's being taught in school.
And kind of the same thing if we flip to like a sensory break or a movement break. Now, our teachers know that movement is necessary now, much more than they did 10 years ago. So children aren't expected to sit in their seats as long. And even universal design has our classrooms having alternative seating. And that's all well and good. But we need, sometimes those movement breaks need to be focused for a specific child. Like if I'm struggling and I'm ramping my engine up and I need to come down, then I need that movement break to be one of deep breathing to help bring me down. And the teacher sometimes just needs that education on, hey, movement breaks are great, but for the wrong student, you're going to send them over the edge and off, right. And they're not going to be able to calm down and finish. Versus a movement break that actually, because I'm getting all wiggly, it brings me back down and centers me. So it's some deep breathing, it's some body holding of positions versus rapid movement and lots of it. Yeah. The child who's falling asleep needs rapid movement and loud movement and lots of movement. But the child who's already fidgeting might not need all that movement because it might just keep going up. Right.
Right. That is so awesome. And so that's another new area for occupational therapists for the mental health aspect.
Yeah.
And something that I have noticed in practice is also the comorbidity. You might have autism, but you may also have bipolar or something else that's attached to that condition. So it's great that we have the skills to provide those services and help, design treatments accordingly.
Yes. And, anxiety about changes in routines. So when I'm dealing with kind of that co-autism with that anxiety and we're going on a field trip. Well, you don't want to go on a field trip because it means my day isn't the way it is, using some social stories to help the student understand that, I'm going to go on a field trip. This is what's going to happen. And the steps are kind of, we do it the week before that. So we prevent those behavior meltdowns or that inability to function through that field trip because I'm so anxious. I don't know what's going to happen next. Those are important things that we can be part of and help that teacher with.
That's excellent. I cannot thank you enough for this wealth of knowledge that you shared with us today. Is there anything else that you might think that I've not touched on? And what would your advice be for families?
So I think, having been the parent who sat in the IEP meetings and been the occupational therapist who's been in the IEP meetings, I think it's always important to bring back to, not as the parent, not my agenda, but what does my student need? And to make sure that I'm listening to find out what that is versus my perception of what they need. Because as the parent, we want the world for our child, and that's awesome. And that's your job. I actually have told parents, you are always to advocate for your child, but in the end, you also need to listen to the educators about what that child needs from their perspective in the classroom, because you don't want it to be too much and you don't want it to be too little. You want that just right challenge for your child. And I think my other advice is to wear realistic glasses, but don't let it determine, don't let what's on paper define your child. Let your child define your child. I will finish with my son, who's my youngest, who is a nurse. And after he graduated from nursing school and passed the NCLEX, he asked to look at his school records. And I left him alone and came back in. I said, do you have any questions? And he looked at me and he says, so based on this, I should be working in a job that is a high school graduate job. I should not have accomplished college. And I said, based on that paperwork, that's what that says. And so I leave that as kind of my closing remarks. I had conversations when he got into nursing school with some close friends about whether my expectations were too high. The advice I was given was to let him continue until he failed. And each semester, we were concerned, but God always said, he's still in the program, he's going forward. And that's kind of my closing advice is don't let it define your child. Advocate for your child, but always be respectful and have that lens where you can kind of self-reflect after those meetings about different things and whether or not, you also need to change or think differently of your child.
That is such an awesome advice to parents who may be actually going through it right now, to give that opportunity and don't put blocks,
Yes. Don't put blocks on your end, and don't allow teachers to put blocks when they're not appropriate, but then also respect the teachers, and then to just kind of keep looking at what's next and find what they're good at, because they need things they're good at. So if academics isn't what they're good at, but they're good at something else like art or music or dance, or
find their strength.
Find their strength and allow them to gain self-confidence in that strength.
Thank you so much. I mean, this is a powerful ending for parents listening in. So thank you so much. And today, again, the wealth of knowledge from different laws, what OTs do in school, what to expect as a parent, and then finishing up with how amazing your son is right now, how what he's accomplished, both your kids.
Yeah, because my oldest actually has a master's degree, and she shouldn't have that either. So yeah,
that's proof.
Yeah, I recently told someone that my children taught me more about how children learn and how to change methods of teaching to adapt to learning styles than probably a lot of my education courses, because it was hands-on experience. Right. And I found out what worked and what didn't work.
And parents know their kids well as well. I think it goes both ways for also therapists and school practitioners to hear, from the parents too.
Yeah. But you have to take the time to learn about different methods of learning. Like I had to do my research. Like, okay, so you're not able to spell by memorization and you don't understand phonics. So how are we going to teach you to spell? Or how are we going to get you to write better? And there's lots of aids out there now. Grammarly, Word documents, all that helps with spelling, voice to text, opens up vocabulary that you can't spell. So there's lots of different tools available to students and parents.
Once again, Dr. Stancliff, Sherry, thank you so much for sharing. And I think we're going to be having this episode into segments so that parents have time to absorb all this wonderful information. And if you have any questions following up in a Dr. Stancliff's episode here, please send it to me. Or if she's willing, I can also pass on her email to you guys in case you need that. And we are very happy to call her back.
There you go.
So thank you so much again, Dr. Stancliff, for your time.
All right. Thank you for inviting me.
Thank you. Bye-bye.